Greetings. Over the last couple of weeks, I've been sharing little revenue cycle tips on LinkedIn. Actually, I've been sharing scenarios from different hospitals I've been going to over the past almost 20 years, where I've had to basically evaluate or educate via asking questions regarding certain revenue cycle processes. And if you're not in healthcare, revenue cycle means nothing to you, but I'm going to basically give you a very quick thing here just so you know what I'm talking about. So revenue cycle basically says that this is the process for how you capture charges, how you charge for charges, how you review bills that don't get paid, because if a bill gets paid, most of the time you don't care, you're just happy you got paid. And then if you didn't get paid and now you have to send something to the patient, trying to collect on the back end. And the processes really go through, most of the hospital, because it starts at registration. You make sure you get the information proper. Then it goes to each one of the departments, depending on the reason the person's in the hospital. Then it goes through medical records, so make sure that everything is coded properly. And when the charges are captured, hopefully they have them set properly already with prices and procedure codes in what's known as a charge master. And then finally, the bills go out. Most bills go out electronic, so no one ever sees those things until they either come back as denied or, pretty much only if they're denied, because if they're paid, no one pays any attention unless they don't pay it in full. And that's really the whole thing. It's an easy enough process to kind of talk about, but it's a hard process to do. And if you don't have someone on top of it, then it's going to fail. And hospitals in general have a very tight margin. A lot of them have what's called a zero balance budget, which basically says that we think this is how much money we're going to spend, so this is how much money we need to bring in, and maybe we can bring in a little bit more so that we can buy new equipment. And really, that's about it. Maybe you can give someone a raise. Now, some hospitals do really well, but they only do well on a consistent basis if they follow the processes. So anyway, I've been doing this series, and they're very short because you can do like a full form article, or you can do a post. And on a post, you're limited to how many words you can actually use, actually how many letters or characters. So I've learned how to master that piece. And in that particular instance, sometimes it looks like I'm blaming the people who are doing the work. Sometimes it looks like I'm blaming the entire process. Sometimes it looks like I am blaming just the person who I'm talking to. And in general, I'm blaming leadership. Because yes, I'm a healthcare finance consultant, but I'm also a leadership consultant. I've written 2 books on leadership, and I've spoken on the topic of leadership. And I've spoken to healthcare organizations on the prospect of leadership in healthcare. Because here's the thing that I see happens quite often. One, there's not any one person who is over the revenue cycle process. Sometimes there is, but in general there's not. So you have that problem where you don't have anyone checking on everyone else to see if their processes are working properly. That's how come I get to consult on that. Then you have upper leadership or upper, C-suite people who will say, okay, look, all you department directors are in charge of your charges, period. Well, you've put people in charge of something, but you haven't trained them on how to do anything. So you just expect they're going to know it. And it doesn't work that way. Most of the time, what happens for a lot of departments is that people are taught by someone who's already there how to capture charges. And that process continues. But at a certain point, they're not sure if that's the right way or not. They're just doing what they were told. So codes change all the time, processes change, computers change. When you have all these things that are changing, if you don't have anyone who's really on top of it, then they're kind of stuck. They don't know what to do. So if their revenue starts to sink, the financial people are going to say, hey, your revenue is sinking. To which the department's going to say, well, we're as busy as we've ever been, which could be true. But, if you haven't kept up with the processes, you're going to fail all the time. People need to be trained. Leaders need to be trained. No one just knows these things by osmosis. It doesn't work that way. So when I'm putting these things out, I'm not sure that everyone notices that it's really a fault of leadership. Whether it's the C-level people, whether it's the management level people or the director level, it's a fault of management. And this is not just in healthcare. This happens every business, everything. You go to McDonald's, and every time you go, you ask for a fish sandwich and you get a hamburger. That's management's fault. That's not the employee's fault. Yeah, the employee may be the one who messed up, but it's management's fault. If you are a consumer and you always go to one place and you ask for the same thing and then suddenly you're not getting that thing all the time, that's management's fault, because they're not either training the people properly or they're not overseeing the work that they do. It all comes down to good leadership. Whether it's in a hospital, whether it's at a company, whether it's the government, it all comes down to having good leadership. Good leadership can pretty much work with anybody. Even if you don't totally agree, if you do agree on working on the exact same thing and trying to fix that one thing, you will find a way to get things done. I always have. Of course, when I'm talking about money and other places want their money, maybe it's a little bit different. But I don't think so. Anyway, if you're a leader out there, think about this. Because, you know what? It is you who's on the line. It's not going to be all those employees. You can fire as many of them as you want to, but it's all going to fall back on you. And it's going to eventually fall back on your organization. So, what are you doing as a leader to learn your job better and to try to make the people that you work with, whether they're your employees or your peers or other people within the corporation, what are you doing to try to make things better? Y'all let me know. My name is Mitch Mitchell. I hope you like this type of thing. Give me a comment if you agree or disagree. I'll talk with y'all next time.